The governor's veto pen stripped $20 million from Northeast Florida projects, including hundreds of thousands earmarked for minority youth and mental health programs. Here to discuss the potential impacts and the need for these services is therapist Nicole Davidson-Harshaw. Nicole, welcome back.
Good morning. Thank you for having me here. Good morning.
Thank you for being here. We're also joined by Suzanne Pickett. She's president and CEO of the historic Eastside Community Development Corporation. Good morning, Suzanne.
Good morning.
Suzanne, your agency is one that was targeted by these line item vetoes.
Yes.
The historic Eastside Community Development group was slated to get $200,000 for a wellness initiative. Can you, first of all, just describe what the program would have done?
So the program would have helped us in our community initiatives to help our residents and organizations identify the barriers from assisting the homeowners and residents from moving forward or accomplishing their goals in the community. And that includes our work in housing, our workforce, education, and arts and culture.
Yeah. And so the program is, designed to kind of address issues that keep people in the community from moving forward, but it has a focus on the impact of kind of systemic racism.
Exactly.
And
yes.
do you feel that that's kind of one of the reasons that perhaps it got hit with the veto pen? We know that there's a lot of projects these days that, kind of have a DEI element that makes them more of a target.
Exactly. In our current political climate, unfortunately, we fear that may be the case because of the demographic that we're serving in the East Side and surrounding communities.
Yeah. And Nicole, talk a little bit about the mental health challenges that are in some ways unique to communities of color, because there's been a lot of research into just the stressors that attend life as a person of color,
Right.
because of various disparities. Can you just sort of run us through what some of those issues are that have emerged?
Yeah. With minorities in general, there's the issue with navigating, inherent trauma. We were just talking about that, the fact that, a lot of issues that are traumatic that get passed down. They become patterns, they become those cycles. And those could look like trauma, anxiety, and depression down the road. However, on the onset, it could be insecurity with, housing instability, food insecurities, economic stress. When it comes to minority women, they're navigating, who they are in a society where they're decidedly supposed to be strong. And that's a pervasive stereotype that continues to perpetuate for a black woman. But the reality is they still are dealing with navigating sexism, racism, responsibilities in their roles as caregivers and anchors to the community, as well as trying to take that pain and push it down so they can be that strong person for not just themselves, but people around them. And so there's a stereotype to that. And then, too, between 2013 and 2019, and there was a doubling of suicide rates for Black girls from the ages of 15 to 24. So that's horrendous to hear that level of statistic. And so those things are still perpetuated in our society, that women are dealing with, that minorities are dealing with. And it really does become an issue when the resources are not there.
And one of the things that, Suzanne's program would provide for is care and services from people that look like the people who are seeking services. I wonder if you can just explain, it is difficult, I think, sometimes for people of color to find someone to, be a therapist or someone that they could, talk to
Mhm.
that is also of color. There's just the numbers aren't there.
Yeah, the numbers aren't there. We have 4% of psychologists in the United States that are Black. And that says a lot, while someone else of a different ethnicity and race would be able to be certified and, professional in providing that safe space for someone. There is something to be said for, Black individuals simply being more comfortable to talk and sit with someone and receive that level of support with mood disorders, with issues that they're going through, and they feel like there's more of an opportunity to be relatable and likely to understand. And that's no small thing.
Yeah. There is also, Suzanne, some historical mistrust
Right.
of the healthcare system, for good reason. There has been, kind of historical baked in discrimination. There's been all kinds of, abuses, whether it's been research or just care.
Right. We talk about neglect as abuse in the East Side, and we talk about the fact that East Side has had no development for over 6 decades. And in my work, when I have these conversations with residents, and unfortunately, even younger students, they feel that there's no hope, that no one cares for them just because of the conditions that they're living in, or just because the caps or the barriers that are placed before them in attaining their goals. So it is very much a wellness issue, a mental health issue of identifying ways and services and methods to assist them, which is what this program would have done.
Can you explain a little bit more about how neglect of community can translate into um, a mental health issue?
So when you're a child, and I'll just speak from my own experience, when you're a child and you're walking through a community and your sidewalks are broken and there's broken glass, broken glass is, as I talk about one of the parks that I actually experienced from a child all the way into adulthood. Broken glass, broken sidewalks, dilapidated houses, your walk every day, your trail of trash, and just neglect. And regardless of who is responsible for that, whether it's your MSA, your city government, your community, that creates trauma, and that makes you think that no one cares for you when your environment is in such disarray in that way.
And Nicole, I mean, this is about, money and services that are available in some respects, but
Mhm.
also just maybe a different way of thinking about, what the needs are for individuals. Do you
Mhm.
have any kind of like big picture messages that, you try to communicate with people who might be reluctant to
Mhm.
seek care for a variety of reasons?
Yeah. The first thing I would say when someone's not sure what they might need is to listen to how they feel. Listen to your body. Listen to what you're noticing about yourself when you're in the room with other people. Um, there's. I want to go back to in response to your question that being culturally competent to yourself allows for you to be available for what you do get to do.
What does it mean to be culturally competent? If you could just sort of break that down.
Yeah, so it's just a very real way of saying that if you are not feeling socially, economically, relationally available to other people in your social circles, in your family relations, then are you being competent enough to take yourself through your day, through your responsibilities and what needs to happen? Taking the time to recognize when you're not okay. Being strong is one thing, but there is no weakness and there is no excuse for having the vulnerability be something that you're not manifesting a different response to. It's okay to seek the support. And what happens in the communities of minorities is that support is not readily available. The resources are not there. And so what we really want to do is have those conversations about how to make mental health resources more accessible to individuals that are really wanting and seeking it. And when they don't seek it, learn how to seek it by educating our communities, educating what's going on, and not allowing those perpetual stereotypes to be strong, mean that you don't have to have the conversation with a mental health therapist. And
Right.
DuPont counseling, I'm a DuPont counselor with JFCS. That's a bigger organization that we're a part of. And we have the resources and the wraparound ability for them to be able to have the support. Yeah.
Suzanne, I'll just ask you what you're nodding along.
I just talk as you talk about, that opportunity or where the resources are not there to have these conversations and conversations that are relatable. A part of our Spaces initiative is getting back to collective care in community where we actually care for each other, where we're comfortable enough to come to each other and say we really need assistance,
Mhm.
and comfortable enough to come together and identify resources collectively.
And just briefly, we should say that despite this veto, you plan to move ahead with this project?
Absolutely, yeah. We've applied. This is our second year applying for these funds that we still have not received, but we're still continually doing the work and looking for alternative methods to expanding this work because it's so important, especially as you see all the development, everything that's happening in and around downtown and the East Side,
Mhm.
allowing those residents to prosper, to be able to stay in place and prosper. And the mental health and wellness aspect is a very important part of that. I mean, it does not exist without housing, education, food, all of that is an important part of mental health.
All right. Well, we should say if you are in crisis or someone you know is, you can call 988. That is an emergency number for mental health assistance. But Suzanne Pickett, Nicole Davidson-Harshaw, thank you so much for being here today. Really
Thank you.
appreciate it.
Thank
All
you.
right.